The United States has spent the last week shattering records for daily coronavirus cases. Last week alone, there were 1.8 million new infections nationwide. NBC News correspondent Kerry Sanders has the latest.
A disturbing 60% surge in daily COVID cases compared to last week. The hyper jump in numbers largely due to Omicron, according to the CDC.
It's hard right now. I hope people can do their part, get vaccinated.
Dr. Jeff Polov in Wisconsin says new COVID patients will likely spend the night in the ER because his hospital is at capacity.
Many of them will be unvaccinated. They'll have regrets. Some will even ask that they can be vaccinated tonight, but I'll have to let them know that it's too late.
Joining medical teams on the front lines, more than 13,000 National Guard troops deployed across 48 states.
I just want to make sure I'm safe.
Dr. Fauci says studies suggest Omicron is less severe than Delta. One out of South Africa showed fewer admissions to the ICU, fewer patients in need of supplemental oxygen, and shorter hospital stays for those infected with Omicron compared to other waves. Still, many are questioning why the CDC abruptly cut quarantine from 10 to 5 days. Those who work in close contact with the public worry they are now more likely to be exposed.
We have policies that are putting this pandemic on the backs of the frontline workers rather than supporting us.
According to the CDC's most recent data, people are most infectious 1 to 2 days before symptoms appear and 2 to 3 days after. So these 5 days are when you'd be the most contagious. And according to the CDC, when up to 90% of COVID transmission occurs. 5 days after you test positive is when the CDC's new isolation rules would end if you're asymptomatic. Not only would symptoms have likely gone away by then, but the CDC says so too would the likelihood of transmitting the virus. Dr. Walensky was also pressed on why no test is required to confirm an all clear.
That antigen test was actually not authorized for this purpose. Its information would not be useful. Regardless of what the antigen test said, we would say you still need to wear your mask for 5 days.
Complicating things, the FDA now says those antigen home tests, which have been in short supply, are also less able to detect Omicron. Lauren Johnson recently took 4 of them after being exposed. They came back negative. Still, she got a PCR.
My PCR test was positive.
Your antigen tests are still a better option than nothing. They're just limited in their sensitivity. You can have what's called a false negative. That could give you a false sense of confidence.